The Ghana Health Service, through a press release, announced that there is an outbreak of dengue fever in Ghana following the confirmation of 9 cases in the eastern region. The disease, which is a viral infection that spreads from mosquitoes and caused by dengue virus, is said to be prevalent in tropical and subtropical areas. Bono's Regional Director of Health Services, Dr. Fred Adumaku-Boateng, described the disease as a malaria-like illness.
These are some of the common signs and symptoms in the uncomplicated ones that you see. One of them is fever, where your body temperature is more than you always have. Then severe headache. Dengue fever, you have severe headache, joint pains and muscle pains. You tend to have nausea and vomiting. Typically, the presentation is just like malaria, but here, the offending germ is a virus. It's not like Plasmodium as we know in malaria. And secondly, the kind of mosquito that picks that virus is also different. Here it's Aedes as compared to the Anopheles that we know.
Even though dengue fever in its mild form can rarely kill, its severer form leads to bleeding in some instances and require hospital care.
Typically, rarely would dengue fever kill anybody. Notwithstanding, it can progress to a severer form, and the severer forms is fatal. And how can you distinguish between the severer forms and the mild forms, which most of us are both? You have intense abdominal pain, one. Then you can also have blood in your vomit or blood in your stool. You can also have blood even from the nose and eye. And this is when it's important you need to seek medical care.
Dengue fever can, however, be prevented through the avoidance of mosquito bites, as they are the sole carriers of the virus.
The measures that we will need to put to prevent us from getting the bite are similar to that of malaria. One common risk is we dump unused ties across everywhere. When they collect water, it serves as a good breeding site for these mosquitoes to breed there, for them to multiply and grow. So how do we prevent them? We make sure at least we don't have a bushy environment. We clear all these cans, broken bottles that can collect water. We should make sure that they are collected and disposed of as early as possible. So these are the things that we can do to prevent us from having dengue fever.
With dengue fever carrying symptoms of malaria, Dr. Fred Adumaku-Boateng was quick to caution the general public to desist from self-medication and carry out tests to be certain of the condition being treated.
If you go and you test and the RDT is negative, it's negative. It's negative. Look for what is causing that fever. And that is what dengue and all the other are telling us now. That the era where every fever is managed as malaria is no more. And we are also packed. We are also part. We the members of the community. Oh, this my malaria is malaria. I have to get injection. This my malaria is. When we don't even test, you are saying that you have malaria. It becomes a difficult thing for the prescriber. So that's what I would say, that make sure, if as much as possible, if you have access to confirmation, let that fever be confirmed so that you know what is causing that fever.
As it stands, the Bono East region is without a single confirmed dengue fever case. However, health authorities in the area are on high alert about the condition and are instituting measures capable of curbing its possible outbreak. Anna Sabit, Joy News, Kintampo.